I am Suzette Walker, and I am one of the nurse practitioners on staff here. Have over in family medicine by the physical therapy department over there. Today we're going to talk about vitamins and minerals and what's good for you, what's not good for you. And I really like interactive conversations when I give any kind of presentation. I'm going to talk about what I think are really safe supplements to use and how do we know if they're safe, and some of the ones that I think most of us should be using. But then I know there's always lots of questions about things that are a little bit more different and not on necessarily the recommended list through the FDA on what we should be using. And one of the ones that I get an awful lot of questions about right now in the office is Cbd oils and supplements. So if you want to talk about that, we can talk about that too. So the first thing I want to tell you or talk to you about is that when we're looking at any kind of supplement, the first thing to know is that supplements are not regulated like prescription medication. Some of them are from other countries, some of them, the ingredients come from other countries, and there is no regulation that tells you that what's in this bottle is actually what's in this bottle. The only way for us to know that is if we buy a vitamin or supplement that has been made in the USA, and it's got to say on the bottle, made in the USA, not packaged for California or packaged for the United States, but actually made in the United States. And that is by law mandated to be printed on the bottles if it's made in the United States. If it doesn't say where it's made, then it's not made here. The other thing is only a very few percentage of those vitamins that are actually made in the United States are actually gone through any kind of regulation process at all. There is an organization called the USP, and they will go in and they check out the vitamins or supplements, no matter what it is, to make sure what is in there is actually in there, and what they're bonded with, the inactive ingredients, is actually safe for human consumption. They're not always safe for human consumption. It's not uncommon that there's a recall from something that comes from out of our country that's actually put together with sawdust or dog food or some other kinds of ingredients. Drywall is a common one that we get recalls on. So this will also be stamped on the bottle. It will say USP. Yeah, and it sometimes is in a circle, sometimes it's in a triangle, but it will be on the bottle. The most common ones that we really trust and recommend are Nature Made and True Nature. TRUNA, True Nature, and Nature Made. Those are made in the United States, and they all go through this USP verification on what it is. There are some others, but those are the most common, and both of them actually can be purchased at Costco, less expensive than in Walmart or the drugstore. You can also buy them on Amazon.com, which is another place that you can look and you can see the label. They'll blow the label up on Amazon for you so that you know. I've had patients who've bought all kinds of vitamins in Mexico that are made in Mexico, and I always think to myself, if you don't drink the water there, why would you swallow something that they made there? I'm not so sure it's a really good idea. On the sheet of paper that I handed out is the ingredients that are in most multivitamins. So when we're looking for a multivitamin, which I think everybody should take, regardless of how healthy our diet is, we're often lacking some things. So a good multivitamin that's made in the United States that has got the USP formulation on it. On the outside column of that is the upper limit. So I have had patients who think they're really doing a great thing by taking exorbitant amounts of vitamins to try to, let's say, prevent colds. It's not going to work. Your body's going to excrete it if you take over a certain amount. If it's a water soluble, you're just going to pee it out. So you're flushing good money down the toilet. Or if it's fat soluble, it will just stay in your body and it won't break down after it hits a saturation point. So there really are upper limits on what we know is safe for consumption. Any questions about a regular old multivitamin? Cheap is good, multivitamin, with or without iron.
Centrum Silver, is that?
That is made in the United States, and it's USP.
And I take the woman's,
Mhm.
feel that is
Yep.
the best way to go on that for my age.
Yeah, I think that's a fine one.
Okay.
Yep, I think that that's perfectly acceptable to do. Generally, the difference between men and women's vitamins is that women's have iron in it and men's often don't. That's the basic difference on it. So besides the multivitamin, the next most important mineral to take, in my opinion, is calcium. All of us lose calcium. So when you go to the doctor and you're looking at your lab work that they just did and your calcium level is normal, that's not because you're getting enough calcium in your body. Your bloodstream is going to suck it out of your bones every time to make it normal in the bloodstream. We need calcium for our nerves to work. There's something called a calcium ion channel that is a synapse. And so for our nerves to work, this calcium and magnesium have to jump over the synapses. So it's going to steal it from your bone every time. So you have to supplement with calcium. Women, 1,200 milligrams a day minimum. Men, up to 2,000 a day. They have bigger bones, so they need a little bit more calcium. If you're thin, like a lot of you are in this room, you need even more calcium because you don't store as much. Fat does store some calcium in it.
Should you take calcium with magnesium?
Yes, my opinion is yes. That's next. So calcium cannot be absorbed without magnesium and without vitamin D. Vitamin D cannot be absorbed without calcium. About 95% of people in Michigan, Ohio, Indiana, Wisconsin, we're vitamin D deficient. We don't get enough sunshine. Vitamin D is absorbed from the sun through your eyes. So if you wear glasses or sunglasses, you're not getting the vitamin D. It is a myth to think that you're just getting it through your skin. It's mostly absorbed through your eyes. So we're deficient. So we need vitamin D, generally anywhere from 800 units to 2,000 units with your calcium every day. Magnesium is a great medication to add to it. So calcium is for bone health, heart health. Vitamin D is for overall health and helps you lose weight, helps with fatigue. Often patients' vitamin D levels that are really low, I put them on prescription vitamin D, build them up, and they have a lot more energy again. So you can't go wrong by taking those supplements. Magnesium added to it helps them both absorb, plus magnesium is also good for our bones. It's good for leg cramps. When patients complain about leg cramps at night in particular, the myth out there is that it's always due to potassium. It's not generally due to potassium at all. It can be sometimes, but more often it's due to magnesium. So 500 milligrams of magnesium a day will often stop night cramps. Some patients actually think that magnesium makes them sleep better, makes them more tired. So I always recommend that people take it at night because of the amount of complaints of fatigue associated with it. Magnesium in high doses can cause diarrhea. Calcium can cause constipation. So you take them together and you have a really happy colon. So I think those ones really work well together. Are there any questions on calcium, magnesium, or vitamin D?
Something that I've always been kind of puzzled with, if you take a daily vitamin and they have all of these, vitamin minerals, all that in there, how much extra really, how do you know how much extra should you take? I take quite a few supplement besides my vitamin, but you kind of want it, but I try the supplements to keep it at a lower level.
Right, that's a really good question. However, with most multivitamins, they have like 200 milligrams of calcium in it.
Very minimal.
Yes, you need the additional, and most of them don't have enough vitamin D or magnesium in it. They're going to have your C, your A's, your B's in it.
You're taking additional.
Right, you always have to take additional.
Along with your daily multivitamins.
Right, with calcium, magnesium, and vitamin D. Will help prevent osteopenia and osteoporosis, increase in fractures. Bone health is what you're really going for with that. And so that your bones stay strong because your blood's going to suck it out of your bone. 1,200 milligrams for women.
then vitamin D.
2,000 units.
I take something once a week though instead.
Prescription is 50, yeah, it's 50,000 units. You should really be taking a daily supplement as well on top of that prescription.
You didn't tell me that.
Okay, the vitamin D, you should.
How much if I'm, oh, sorry.
2,000. 2,000 a day is
To go
is
to
is
that
the
2,000 is the best in supplementation with your multivitamins.
Yes,
Okay,
2,000,
additional.
yes,
That
yes.
is kind of
right gold standard.
a
Yep.
oh,
Yep.
okay.
Yep.
2,000 in addition to the once a week.
Right, 2,000 a day, in addition to the 50,000 a week, and the calcium and the magnesium to help it absorb. If your vitamin D level isn't going anywhere, it's because you're not getting enough calcium. If it's not going up after you've been on it for a while, you're not getting enough calcium. Calcium through food is milk products. That's where you get it. So cheese, milk, fortified, the like silk, the soybean, or not, that's not soybean, is it? Almond milk, thank you, is fortified with calcium and vitamin D most often. Vitamin D is fortified in milk too.
But almond milk does not have any protein in it.
Correct.
I learned that. I
Yes.
started drinking it. I had my blood work done. And
Yeah, their protein was down
low,
the,
but-
yeah, yeah. Some people who can't tolerate milk, it's a good alternative for them.
Well, I like this fat-free, lactose-free milk in the store I buy. And is that good with vitamin?
You'd have to look in the package. It will tell you fortified with calcium and vitamin D on the package. If it is, it would be under the nutritional value on it. Per brand, I'm not going to be able to answer that. Okay, so another supplement that I believe strongly in, although there's mixed data out, and one of the more recent studies urged us to be a little bit more careful with it, is an aspirin a day. Unless you've had a stroke that was from a bleed in your brain, not a clot, but a bleed, everybody should be on aspirin, one baby aspirin or regular aspirin a day. It helps protect against heart disease. It helps protect against CVA, stroke, ischemia in your brain. It helps protect against colon cancer. What it does is it keeps your blood vessels all open so that the periphery of your body keeps being infused with blood and gets oxygen and nutrients out to it. So aspirin is still recommended for most patients.
I have a question on that. I had a blood clot in my leg a number of years ago, and the doctor, it wasn't it was more of a superficial.
A phlebitis. Mm-hmm.
Okay, but then he recommended I take an aspirin a day, and I have, but I take the regular stuff.
Yeah, yeah,
So,
yep.
so that's okay. I don't
Right.
have to switch to the
No,
baby.
no, I would not switch. So
Okay.
if you've had a history of a blood clot, a baby aspirin generally is not enough to keep your
Okay.
blood thin enough. You need a regular aspirin. That's the difference between a baby and a regular aspirin. The studies were done on both for protection against heart disease, ischemia in the brain, and colon cancer, and they're the same for a baby aspirin versus a regular aspirin. Your risk of bleeding is a little bit less with a baby aspirin versus a adult aspirin. If you're on another blood thinner, though, make sure that your provider tells you it's okay to take an aspirin a day, because it will increase your risk of bleeding. Like if you're on Plavix or Eliquis or one of the other blood thinners, Coumadin, God knows you want to make sure that it's okay for you to take the aspirin. Any questions about aspirin? Cheap is fine, as long as it's made in the United States. Okay, my next favorite supplement is omega-3s, fish oils. The data is good on fish oils. It helps prevent high cholesterol. It helps bring down your LDL, which is the bad cholesterol. We want that number about 100 to protect us against heart disease and stroke. So fish oil will do that. It also helps keep blood flow into your brain. So there's some data that shows that it will help prevent dementia or TIAs, any incident where you're not getting enough blood to the brain. And it helps with joint discomfort too. It will help put a little bit of fat back into your joint space for that. The dose is up to 4 grams a day. when I start a patient, I usually start them on 1 gram a day or 1,000 milligrams. That's the size of most tablets you buy in the store. And go up to 4,000 a day. A few patients will complain about that they feel like they taste fish all day with some of the fish oils. If you do, go try a different brand. I don't think the more expensive are better as far as health benefits, but some patients do find that they're better tolerated as far as the taste goes. Fish oil is a really important supplement for us to take. Do most of you take fish oil? What? No fish oil?
No, I take the 1,200 milligram twice a day.
Yeah. Yep. So you're on 2,400 milligrams.
Okay, would it be good to up that a little bit?
I would say that would depend on your cholesterol numbers. That is a great number if your LDL, your cholesterol is in pretty good shape.
But if you do have a little higher cholesterol to up this.
Yeah. Then I would recommend you up it. If I was having a hard time controlling your LDL on the 1,200 or 20,
okay.
then I'd ask you to increase it.
Up to 4,000.
Yeah, up to 4,000 a day. If you go beyond 4,000 a day, it starts interfering with clotting, blood clotting, and you don't want that either.
And then also they speak of this, the flaxseed and that.
Uh-huh.
Is this fish oil one of the best ones to take? Or is it
Omega-3s are the best. So you get those primarily from fish, salmon, trout, tuna fish.
that would be
Yeah, those are the best ones. Flaxseed, I do recommend to people who are allergic to fish or can't tolerate the fish oil.
alternative?
Right, as an alternative to the fish oils as far as the omega-3s go. There's something called it's coming to me, krill oil, what is it?
Red rice?
No, that's another good one though, but this is a particular, I think it's called Mega Red. It's a particular brand of fish oil that you can buy that is very expensive, but there is no benefit over that one, over one of the less expensive ones. When patients bring that in, I tell them that we really don't need to be spending that kind of money on your fish oil. But red rice yeast is also something that will help with cholesterol. It won't help with some of the other things that fish oil do, but it will help bring down your cholesterol. Which brings me to Psyllium, another one of my favorite products. Psyllium is Metamucil brand name, powder. So that particular fiber, Psyllium, Psyllium, is been shown to effectively lower LDL as well. It helps prevent colorectal cancer. It will help you lose weight. Patients who use Psyllium once a day lose about 1 pound a month. So that's 12 pounds a year. That's not bad for a supplement. But it's very effective. I use a lot of Psyllium and fish oil for patients with high cholesterol. Don't confuse it with some of the other fibers like methylcellulose. Some of the other ones won't do the same thing. It's got to be Psyllium. Psyllium is a grain husk. And 1 dose. So if you're taking it for constipation or for diarrhea, the dosing is usually 3 times a day. If you're taking it for cholesterol and for health, it's 1 dose a day. And it's a scoop, usually, that you would take. It's a grain husk. It's a powder. It's sold, the brand name is Metamucil, but every store has a no brand right beside it.
I see it as
Yeah.
alias.
Yeah.
I
Yeah, but there are lots of different fibers. Benefiber is one, and it's not the same. It's not going to prevent against colon cancer, and it's not going to do anything about your cholesterol. Psyllium is the one that will do it. Yeah, yeah. It's the only one that's been shown to be effective.
How much of that?
1 dose. And that's going to be, depending on what brand you're buying, it's usually a capful or that comes with a scoop. So whatever 1 dose is on the package would be the dose for that.
It's highly beneficial for many
Right. It's been shown to help protect against colorectal cancer, lower your LDL, help with weight loss.
So you can take that along with all this,
Right.
all these other things.
Right. Now you do, if you're taking prescription medication, you don't want to take it at the same time as your Psyllium because you don't want it to just dump into your colon and exit. So especially thyroid, you need to take it away from thyroid medication in particular. be careful what you mix with your thyroid. The next one on my list is glucosamine and chondroitin for joint pain. Does anybody take that?
What is it?
Glucosamine and chondroitin, two different substances. It's been studied extensively in animals. It is what a lot of vets use for animal joint pain, hip dysplasia in big dogs, and there are significant or some studies in humans that also show that it helps protect against joint pain or help rebuild cartilage for joints. So I like to recommend that in patients with joint pain, especially those that don't tolerate NSAIDs, which is the gold standard for joint pain. You have to have a non-steroidal osteoarthritis. Yeah, yeah. Mm-hmm.
I do take it, but
Yeah, it's for joint pain. Knees and hips in particular are the ones that I found it to be the most beneficiary on. And again, you have to look at the label because they're all going to be dosed differently. A lot of them are like 3 pills a day, some of them are 2 pills a day, but follow the directions on the ones that are made in the United States and have the approval of the USP. Then you'll be able to protect against joint pain or help rebuild your cartilage and your bones. That, in combination with fish oil, can be very effective for joint pain, especially in those that don't tolerate the NSAIDs for treatment. Any questions about those? No. Okay. I have B complex on here as the next one to talk about, primarily because I have a lot of patients that take it. The only studies that it has been shown to be effective in is for neuropathies. If you have peripheral neuropathies of the hand or feet, vitamin B6 can be beneficial, especially if it's given in combination with calcium. Remember, you need calcium for those nerves to work in the right direction. So combining the B6 with the calcium will help with peripheral neuropathies. Oral B6 or any of the B complexes for a vitamin B12 deficiency are not going to be very effective because they're not absorbed as pure vitamin Bs in the GI tract. They have to be absorbed in the small bowel and they start breaking down in the stomach. B12 deficiencies are really common in anybody who's had gastric surgeries as part of their stomach or intestines are removed, so they are not able to get the extrinsic factor and then get it into their bloodstream. So we often need to supplement those. But the best way to supplement them is with injection. The liquid B12 supplement that it comes in a very concentrated dose can be absorbed because it passes through the stomach and into the small bowel, but the pills really aren't absorbed as Bs. You have to take a lot of them to help. Coenzyme or Q10. Do I have anybody here that takes that? Yes. Yeah. So one of the best uses for CoQ10 is patients on a statin. If you are having joint pain from a statin, which is reported in 10% of the people, this will cut that down drastically. CoQ10 is an anti-inflammatory, and so it really will help with side effects from a statin. It also helps protect our heart, builds muscle. It's a good all-around supplement.
How's this spelled?
Well, it's coenzyme 10, but a lot of the bottles will be a Q10. Yeah. Mm-hmm. And then folate. Folate should be taken by all women who are of childbearing age in particular. You need it to protect against some of the birth defects. So I like to put teenagers on a multivitamin with folate and recommend it to my grandkids and their friends and put it in their Christmas socks and, that birth control pills. No.
What about beyond the childbearing years?
Folate is a B vitamin. So if you're deficient in B vitamins, folate can help. but it's really recommended in younger people. But if you have a B deficiency, then it's not going to hurt you being older, but you might not need it.
I take a B complex,
Mm-hmm.
and then I also take the folate, but maybe I really don't need
Your B complex probably has folate in it, but you'd have to look at the ingredients because it is a B.
I mean, I don't care to take it.
Yeah. Yeah. There are some drugs like methotrexate, which is given for rheumatoid arthritis and stuff, that you have to give that in combination so you don't get toxicity from it. But that's going to be then prescribed to you by your provider. So those are the list of supplements that I routinely recommend in my own practice and think have a lot of different uses for the general public. So now I'm happy to answer anything about something that you might be taking or that you want to talk about. Yes, Linda.
Suzette, do you know anything about Puritan Pride? Are they?
I would have to look at the bottle. I know that that's a brand, but I would have to look at it to see if it's actually made in the United States. There was a brand, it was called Doctor's Best, and that was touted as one of the best vitamins that you could buy. It was great. It was, pure. We knew what was in it. About 4 years ago, it got sold to China. So it's no longer manufactured, the products, none of it comes to the United States yet. So things change so rapidly, you really got to look at the label to see where it's coming from. Mm-hmm.
What about prebiotics and probiotics?
Yeah. So probiotics, I think, have a really good place for us as a society. One, if you're on antibiotics for any kind of infection, you're going to mess up your own bacterial system. So replacing that or taking a probiotic while you're on an antibiotic is always very helpful for the GI tract. Sometimes people who have diarrhea and you can't find any reason for it, you've done cultures, you've changed foods, there's no food allergy, putting them on a probiotic and or Metamucil will straighten all that out. So they can be very helpful. It can also be helpful to help prevent against urinary tract infections and vaginal infections. Same thing. Those parts of our body need a certain amount of bacteria floating around in it. So that will help replace that. So.
I was going to say, it used to be recommended when you traveled out of the country.
Mm-hmm, mm-hmm. Yeah. You're exposed to all kinds of things often, water in particular, that has bacteria in it that we're not used to. They can drink it fine because their guts have adapted to it, but we're not. So yeah, you can replace your flora and often stop symptoms of diarrhea if you take probiotics.
There's so many different types.
There are. There are. It's really, really hard to know which is best. The Philips makes one that's called Colon Health. That has the ingredients in it that has been shown to help for colon health. So I usually tell people, look at that bottle and then find one on the shelf that's cheaper that has that in it. It's Philips, like good old milk magnesia, Philips brand. So it's that brand, and it's called Colon Health Probiotic. Mm-hmm. My favorite color, that's why I recommend it. It's in a pink box. No. But it has the right ingredients in it for our GI tract. But probiotics can't fix everything. You don't need to buy every food that's infused with probiotics or prebiotics, and not everybody needs them. Sometimes people with irritable bowel syndrome can be greatly helped with probiotics. They have a lot of bloating, intermittent diarrhea, constipation. It's really a bacterial overgrowth or undergrowth that can help them. So it's worth a try with a lot of different GI complaints to see if it will help. Other questions? Yes.
I know you're an animal lover, but I'm not sure if you can speak to this or not. About a month ago, my dog got really dry, itchy skin, and a friend of mine, her cousin is a vet, and said, oh, you have to get this fish oil for dogs.
Mhm.
So I've been giving my dog
Yep.
fish oil for dogs.
Yep.
Itchy skin has stopped, but could I have just given her my fish oil?
Yes.
Okay.
Yes, and it's much cheaper. Just like you can give your dog your glucosamine chondroit, it's much cheaper than buying it through the vet. That's my dog gets over the counter.
Thank you.
You're welcome. Fish oil does help some skin disorders because it's an oil. Yes.
Has there been any studies or that you know of about magnesium helping with migraines or headaches?
Yes, actually there's been studies that were done both at University of Michigan and at Henry Ford, and it's widely used for patients with migraine headaches or tension type headaches, cluster headaches, that magnesium can be effective. It's one of the things that just you throw at people to try to help them.
Now my daughter's 10. What is there like a certain dosage? Is it okay to give that to her? Like she's been getting them more frequently, and usually I can give her Tylenol or ibuprofen, and it's fine. And they're mostly at night when she gets them.
Yeah.
But do you think putting her on
It-
magnesium supplement would help?
It can't hurt her. Now, to decide on what dose, that you need to know more about what body size she is. There are some 10-year-olds that weigh as much as what we consider adult. You know, so if she was anywhere close to 100 pounds, she could use the 400 to 500 milligram. If she's under that, then you're not going to want to saturate her. You know, if she's a 60-pound little thing, you're not going to. Yeah, she's close, so, you know. Usually with magnesium you can buy over-the-counter 250s, 400s, or 500 milligrams in a capsule. Yes, Linda?
I've seen some different supplements for eyes.
Mm-hmm.
One is LUT or something.
Mhm.
I just
Mhm.
wonder, do you know anything about those?
Most of them are made up with a component of a omega-3, and it's the lubrication that will often help in it. I can't speak to each one, but that's what a lot of them have in it that will help with eye health.
Omega-3, I really don't need the extra.
If your ophthalmologist recommended a particular one, I'd look to see what the actual ingredients are in that, and if it's an omega-3, then you wouldn't need others. If there's something else in it, I'd want to know what that other product was.
No, it hasn't been recommended. I'm
Okay,
just seeing.
yeah, there are vitamins for eye health that most of them are made up of omega-3s, fish oils, yeah, krill oil.
What about all the CBD oil?
Yeah,
Yeah.
Yeah.
Everywhere, isn't that
right. So, you know, that is a Pandora's box, shall we say. So the original CBD oil is an extraction from marijuana plants. Okay, so that is not legal. So what you see in health food stores and being sold at the video stores, what is it, Family Video now has it, and in your food, is a concentrate that's made from hemp. Hemp is a cousin to marijuana, but it is not the same plant. Hemp does not have any THC in it, which is the active ingredient in marijuana that's been studied mostly for seizure control, for pain control, and that's what makes people high, right, is the THC. So hemp oil doesn't have any of that in, but it's also not been studied at all. CBD oil from marijuana is but what we have this much information on. Hemp, nothing. But people believe that rubbing it, sometimes I have patients that rub it on their back or on their knees, that it helps with pain. I have people who take the drops for anxiety, for pain, for sleep, and they swear by it. But there is no scientific data on it. It can't have THC in it and be marketed legally anywhere. So it's probably nothing in it that's going to hurt you, but is it going to help you? I don't know. And I'm not a proponent of THC in the first place, but I have a lot of patients who swear by it. I've had patients I've been able to bring off Norco, an opioid, by having them to use the CBD oil that they can buy at the health food store, which is hemp, not marijuana. So, but
Just not studying enough yet.
right, there's no studies on it. So it came out because the FDA legalized hemp to be grown in the United States for the first time since World War I, World War I think it was. Hemp got legalized because you couldn't tell the difference in the field between hemp and marijuana. They look alike. So at that time they did. Now they've been mutated enough that they don't. So it was made illegal just like growing marijuana was illegal. They made it legal because it's a cash crop and they're going to be able to, they make material out of it, they make all this other stuff, and the food industry is going wild with it because they're putting in everything, but it's not been studied. It kind of reminds me of the early days with tobacco. When tobacco was first grown and made into cigarettes, nobody had a clue what destruction that was going to do to our people. It's the leading cause of cancer in the United States, and nobody knew that. So it was only after years of research that you found that out. And now we got hemp, and who knows what it's going, we don't know. We don't know what's safe and what's not. I would think rolling it on you can't be too bad, but I don't know about ingesting it. I have patients that swear by it. But it is not marijuana.
I wonder why it's not studied, or someone they're trying to study it, or nature, you think?
Yes, there are places that are trying to study it, but like a lot of that stuff, it gets out there, it gets into the market, it gets a lot of publicity, people swear by it, and then nobody will enroll in studies because they don't want the placebo, they want the real stuff. So actually doing the studies get more and more difficult to do because you can't get participants to do it. So it gets difficult. But yeah, it just got legalized to even grow here in the United States about a year and a half ago, which is why it's all over right now. But does anybody use it for pain or anxiety here? Yeah. And you swear by it? Because a lot of people
I've
do.
been on it for a year.
Yeah, and you think it helps.
Diagnosed with rheumatoid arthritis. So
Yeah. Yeah.
on and off, maybe.
Yeah.
Like,
Yeah.
Do you
Yeah.
use the oil or a
yes.
oil?
Under the tongue.
Oh,
But I know people that use it too and stuff, but there's so many brands and
Right.
qualities, I know.
Well,
How
you
do
don't
they
know.
get-
You don't
people
know.
say, you've gotta get the really good stuff.
You
or
don't
the
know.
pure
Right.
stuff, and
Right.
is it that
Right.
only the expensive stuff, so I don't know how they even
Right.
measure it.
Right, and it's not regulated, so there's no controlled studies on it. Now there are a couple of companies, Green something,
Yeah, green something, it's outside Willis Supermarket, that they've got this green CBD now.
It's a brand, Green something. I get emails from them. It is self-regulated. They have a laboratory that they look and see what they've got in their product, and then they also contract with an outside laboratory to make sure what they think they have is. But most of them that you're buying at the family video store probably aren't regulated. You really have to do your research on it.
All kinds of stuff in them, arsenic. and
Yeah,
lead and, you know,
especially because you don't know what's in it. I wonder if I have a. I
is it
send.
HempWorks? HempWorks?
No, it's Green something. I think.
Charlotte's Web.
Charlotte's. Yes. Right. Charlotte's Web. Mm-hmm. Yep.
Blurb on it on
Yep.
Channel 7 News about a week and a half ago, and it went so quick, they had the top 5 on the screen, and before I could get my phone out to take a picture of it, it was gone, but one of them was Charlotte's Web.
Right.
It was a good brand.
Charlotte's.
That physician, whoever he was,
Right.
recommended.
Charlotte's Web is the brothers that started that are the ones that did the original research with seizures with THC in children. And then it went from that to then the hemp oils. But they are a very reputable place. But I think it's very expensive,
Yeah.
but they're regulated. And then there's one that starts with green. It's lost me. That's what happens when you're 61. It comes and then it goes. But
What can you take for that?
But yeah, really, yeah. Boy, I need a bushel of it, yeah. Fish oil would help with your cognitive function, and high protein. Eating high protein, of course, is very important too. Well, I did bring a couple of other handouts if you're interested in this. This one is food sources for potassium. You know, when I tell people that we gotta increase their potassium intake a little bit, they always think of bananas and oranges, and there's things that are a lot better. And so I love this handout to give to people if anybody wants a potassium handout.
I just have one question about vitamin K2. I have read that it's very
Yeah.
good for bone health.
Yeah,
and
I would stay away.
What do you know about that?
Right. So I would stay away from vitamin K entirely unless your doctor tells you to take it. Vitamin K causes clotting. So clotting, right. So vitamin K is the antidote to Coumadin, to any of our other blood thinners. And so if we want you to be a little loose on your blood, a little runny, you do not want to be taking vitamin K. Plus it will interfere with a lot of different medications.
So, okay, so your recommendation
I
is
would,
to shy
right,
away from
unless you have a one-on-one conversation with your health provider saying, I would think you need vitamin K, I'd stay away from
You
it.
can't believe everything you hear.
Right,
and all
right,
that.
yeah, it can be really messed up with some of your stuff. And then the other handout I have is on the Mediterranean diet. You know, we have a lousy diet in this country, right? We have the highest rate of obesity of any other country, and we eat way too much processed food. And I could go on, and I'll be quiet now, but that's my opinion. So there are two diets that have been shown to be extremely effective with weight control, to help us lose weight and to live longer than we would without, and that get enough vitamins and nutrients in our food. And one is the Mediterranean diet, and I really believe in this diet a lot. So I recommend it to patients. The other one is called the DASH diet, D-A-S-H. That was originally one of the diets that was done with the American Dietetic Association, and it is for blood pressure, so it's a low sodium diet, but it's also very good with calories and weight loss, and I have huge handouts on that too. It has a lot of information on the internet. If you Google DASH diet, it will bring you up with recipes and how many calories and all kinds of things with that. But the Mediterranean diet is the other one that I recommend a lot to people. Because you have to have healthy fats. And if anybody thinks that coconut oil is healthy, you're wrong. So if anything turns to a solid, it is not good for you. Coconut oil turns to a solid when it's not heated or mixed with something else. So it is a saturated, really bad saturated fat. So it can be rubbed all over the outside of your body and your skin will be beautiful, but don't swallow it.
Suzette, Psyllium. You said something about don't take it with your thyroid. How long do you have to wait?
The psyllium?
Yeah.
The psyllium should be taken an hour after your thyroid, or 2 hours before. But most of us take our thyroid really early in the morning.
I do.
Yeah, yeah.
So 1 hour after.
Mm-hmm. The question was with psyllium and thyroid, you need to take the psyllium 2 hours before your thyroid or 1 hour after so that it doesn't interfere with your thyroid medication. So you actually absorb your thyroid medication, which you need. The psyllium would be 2 hours before your thyroid or 1 hour after your thyroid replacement. So it doesn't interfere with the absorption of it. And you know, most of us were taught that we should take our thyroid first thing in the morning on an empty stomach, and it is absorbed well that way. But as long as you take it exactly the same way every day, your levels will be consistent. I take it with my handful of vitamins and 4 cups of coffee. It works for me. Yes.
Are there these vitamins that would be for heart medicines not good to take with the
It does depend on what heart medicines you're on, especially if you're on a blood thinner, like Eliquis, any of those need to be talked about with your provider if they think they're okay. Because what I might think is okay for one patient, I might not think is okay for another patient because you might be on other medicines like nitrates or something that's you don't want to mix. Like nicotine patches, don't use them either. If you smoke, don't use them. So.
What about collagen, Suzette?
Yeah.
There's so much on that.
There is a lot on collagen. So, can our bodies make collagen? You would have to ingest a whole lot of collagen for you to make any new collagens. Some collagens, if they're very, very small molecules, can be absorbed through the skin, but they got to be incredibly small. Like hyaluronic acid is a cream that has a little bit of collagen in that can be absorbed, but most of it's all very topical and can't be absorbed. There are people who swear that collagen will, rebuild their fingernails and make their hair grow better, but your hair is dead, guys. Once it leaves that follicle, it's dead. We're not going to make it come to life with anything. CPR is not going to work on your hair, so it is what it is. But yeah, so I don't think there's enough data out there, or the collagen hasn't been perfected enough that it will actually be absorbed. If it's stem cell, that's different. Now, there are some stem cell products that will help stimulate collagen.
Any last question for Dr. Walker?
Thank you. Thank you.